Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my daughter-in-law has been ventilated with tracheostomy for 4 months. How can we get her off the ventilator? And that was part 3 of the question. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is: my 76-year-old dad has been in ICU for 1 month. He can't be weaned off the ventilator and his tracheostomy. What are the alternatives? Please help. So this question from Felix formed part of a number of consecutive email and counselling and consulting sessions with me. So Felix writes: Hi Patrick, first of all I want to thank you for your kind and generous service for many caregivers who have their loved ones in intensive care. My dad is 76. He has been in the ICU ward here in North Carolina since May the 17th, and his stay in ICU has now been for about a month. He has had complications with MRSA and CRE pneumonia. He was given 3 types of antibiotics: metronidazole, polycymin B, and tetracycline. His lungs, to say the least, have taken a beating. In the 4th week he was taken off the antibiotics. His lungs are much clearer now according to the last chest x-ray. The blood cultures have come back negative as well. They have been trying to wean him off the ventilator and they didn't have much success. They tried him on the tracheostomy collar for a couple of days to wean him off the ventilator. At first he lasted for 12 hours, then 8 hours, and now he has gone backwards to only be tolerating between 1 to 3 hours off the ventilator. When he's off the ventilator, his heart rate will go up to 130 beats per minute when he's off the ventilator and on the tracheostomy collar. He is also on carvedilol to keep his heart rate between 70 to 80 beats per minute. He does have chronic heart failure with 40% left ventricular failure. His blood pressure fluctuates between 120/75 to 90/45. His breaths per minute on the ventilator are between 14 to 17 per minute. When he's going on the trachea collar, his breaths per minute is going up to 40 per minute. His ventilator machine delivers him oxygen between 45 to 60% at night. Generally his oxygen saturation is at 100%. The therapists also keep his bed propped at 45% to strengthen his lungs. The doctors don't want to keep trying him off the ventilator in the intensive care unit, and that my dad would be a candidate for a long-term facility to be weaned off the ventilator. The doctors say that because of the severe pneumonia his body and lungs had to endure, he is weak, and it therefore will take him longer than what they can keep him in ICU for. So, how long can someone in my dad's circumstances be able to be weaned off the ventilator? Thanks for your valuable time, from Felix. Hi Felix, thank you for your inquiry and for using my email counselling and consulting service. I have also received your phone message. I appreciate your kind words and I'm sorry to hear the difficult circumstances that your dad is finding himself in. There is no straightforward answer to your question because critically ill patients on ventilators with tracheostomies are different, and therefore the time frames differ in how long it'll take them to be weaned off a ventilator and the tracheostomy. However, I have a number of suggestions from my experience, and I'm sure you'll find some useful advice after having worked with hundreds of ventilated patients with tracheostomies in intensive care, as well as in a home care environment. My best advice is to start with an article and a video that I've made about tracheostomy and weaning off the ventilator in intensive care. How long can it take? So if you are watching this video on our website, just go below in the written version and click on this link, tracheostomy and weaning off the ventilator in intensive care. How long can it take? So you'll find more information there. If you're watching this video on YouTube, just type in the title, tracheostomy and weaning off the ventilator in intensive care. How long can it take? And you'll be directed to the video. So this article and the video will give you a good overview of what to expect. But there are a lot of other things that you as a family member can influence if you find the right information and if you get the right advice. You also need to be prepared to what the 99% of the families in intensive care who make no informed decisions, who don't get peace of mind, don't get control, don't get power, and don't get influence, are not prepared to do. If you are prepared to go against the grain, take my advice, you will see the results, period. To start off with, your dad will need to get into a proper day and night rhythm whilst he's in intensive care. Most long-term patients in intensive care have a disturbed day and night rhythm, and this is simply because intensive care is a 24-hour environment with all sorts of disturbances going on 24 hours a day, including care needs, especially whilst being on a ventilator with tracheostomy. Next, you've mentioned that your dad has chronic heart failure, and therefore weaning him off the ventilator might take longer, or at the very least it might be more challenging, as a weak heart usually impacts on the lungs as well. Furthermore, starting your dad off on 12 hours a day on the tracheostomy collar, especially with a weak heart, might not be the right thing to do. Usually, a slower weaning process is a gentler and also wiser approach, and it has a better chance to succeed in the long run. You have also mentioned that your dad still needs 40 to 60% of oxygen whilst on the ventilator. That's still a fair amount of oxygen, and it doesn't surprise me that your dad is only lasting for 1 to 3 hours on the tracheostomy collar. Usually, oxygen requirements on the ventilator should be less than 40% before starting the weaning process on a tracheostomy collar or a tracheostomy mask. Combining this with a weak heart, and you have a recipe for making it a slow wean off the ventilator. Starting off with 2 hours off the ventilator and 2 hours on the ventilator during the day, and then increasing the frequency to stay off the ventilator might be a more successful approach. Again, your dad might be frightened when he spends too much time off the ventilator, especially since it's been 4 weeks now that he's been in ICU and on the ventilator. Once your dad can tolerate more time off the ventilator, as his strength increases, he can hopefully get into a routine where he stays off the ventilator during the day and get back on the ventilator overnight. This would also get him back into a normal day and night rhythm. Getting him a good night's sleep is vitally important so he can feel rested for the day and have strength to have time off the ventilator. Good nursing care is also extremely important and is often highly underrated. Your dad needs to get good mouth care, eye care, regular washes and showers to make him feel comfortable and well looked after. You also mentioned that they keep his bed at a 45% angle to strengthen his lungs. That can be important and it might contribute, and it's not enough. Your dad needs to get out of bed at least twice a day at a bare minimum. The physiotherapist and also the nurses need to mobilize your dad into a chair. That's absolutely vital, and it needs to happen, full stop. This will help, and it will build up your dad's strength. Most importantly, you need to think outside of the box. The intensive care team wants to send your dad to long-term acute care, and they probably want to do so because the ICU team doesn't want to continue weaning your dad in ICU, most likely for bed management reasons and also for financial reasons. That's most likely what's happening. However, before your dad is going into long-term care, you should consider a much better alternative. In this day and age, intensive home care is a genuine alternative to a long-term stay in intensive care, and for example, a service like intensive care at home can wean long-term ventilated patients with tracheostomies off the ventilator at home. You may want to consider this, and you can find more information at Intensive Care at Home. Google Intensive Care at Home for more information, or simply click on the link below this video. Furthermore, your dad has been in ICU for 1 month now. Therefore, it now might be the right time to get the ball rolling to get your dad home with specialized intensive home care. Other, more specific help that I can offer you now is to check out the following ebooks and videos. One ebook is the 7 answers to the 7 most frequently asked questions if your loved one requires ongoing mechanical ventilation with tracheostomy in intensive care. Check out the ebook and the video below this video in one of the links. The other ebook that you might want to check out is Follow This Proven System to Avoid the 3 most dangerous mistakes you are making but you are unaware of if your loved one requires long-term ventilation with tracheostomy in intensive care. Both ebooks and videos will give you specific insights into long-term ventilation and tracheostomy and will help you to make informed decisions, get peace of mind, control, power and influence irrespective of the challenges. Both ebooks and videos will help you to get a handle on things and will give you insights of what's really happening, and the information is cutting through all the myths and the BS, and it'll help you to get your desired results. Another option obviously is to talk to me personally over the phone or Skype and get more of my one-on-one counseling and consulting services, and there I can go into even more detail. You should also check out our Your Questions Answered section, where you'll find a ton of questions about the issue tracheostomy and long-term ventilation as well. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. you'll get crucial behind the scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecare.com with your questions. Or you can call me. Find international phone numbers on our contacts tab. Also check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the tabs on the top of the website. This is Patrick Hutzel from IntensivCareHotline.com, and I'll see you again next week in another update.